Perfect. Thank you. Thank you. So hello, everyone. I'm really happy to be here tonight to talk about this important and interesting topic that we have. So as my introduction indicated, I'm a neuropsychologist, and my job as a neuropsychologist is to assess cognitive functioning. So basically, I give tests to patients to find out if they're having problems with abilities such as their memory, their attention and concentration, their problem-solving abilities, spatial skills, language, which is what the topic of tonight is, etc. So my own talk tonight is going to be one in which I provide you with a lot of background information about the specific kinds of language problems that you might see in people with dementia. Okay, sorry, that was my first slide that I missed. So I'm going to start off with a couple of definitions which I think are important to this whole topic. So one definition we're going to start off with is communication. So one, if you look at number one, it says the imparting or exchanging of information or news. So that implies that communication involves both getting information out as well as taking information in, and we'll be talking more about that later. And the second note in the definition is, and I think this is really important, is that communication is a means of connection between people. And the word connection, I think, is really meaningful here because communication is absolutely essential in bringing people together and connecting us. So it's truly very difficult when a person with dementia experiences communication problems, which in turn has a significant impact on the connection between that person and their loved ones. So that brings us to language. So we're going to focus on the first definition here. So language is a specific form of communication. That is, it's the method of human communication, either spoken or written, consisting of the use of words in a structured and conventional way. And we got one more definition here. So I just want to talk a little bit about dementia because that's the second word in our title tonight. So in order for a person to be diagnosed with a dementia, there's actually two criteria that have to be satisfied. So the first one is that there has to be an acquired and persistent decline in multiple domains of cognitive functioning. And by multiple, I mean at least two areas of cognitive functioning have to be affected. And these are things, again, like memory, problem solving, concentration, spatial ability, language, etc. And the second criteria is that the impairment has to be severe enough that it actually interferes with your daily functioning. So the cognitive problems need to have an effect on daily living skills, so things like, managing your medication, or driving, cooking, managing finances, those kinds of things. So it's also important to understand that dementia is not a disease in and of itself. So it's the consequence of diseases or conditions that impact the brain. And there are in fact many, many different diseases and conditions that can cause dementia. So this slide lists only some of them, and I'm not going to go through them, but the ones highlighted in red are some of the more common causes of dementia, with the most common one being Alzheimer's disease, of course. Okay, so here we have a nice picture of the brain, which, by the way, is not really that color in real life. But it does kind of help to show the different parts of the brain. So depending on the disease that causes dementia, the dementias can actually look really different in the early stages because it really depends where in the brain that disease is affecting the brain and where the symptoms are going to come up. So for example, in Alzheimer's disease, the temporal lobes are initially affected, and that's actually where memory is located in the brain. So that's why memory is often the first symptoms that you might see in Alzheimer's disease. Okay, on the other hand, in another type of dementia called frontotemporal dementia, this disease can affect both the frontal and the temporal lobes early on in the course. So if the initial effect is, let's say, in the frontal lobe of the brain, then the initial symptoms would probably concern things like personality and behavior of the person as opposed to memory. Okay, so what about language? You might wonder where language is located in the brain. So there's actually two main locations in particular where we see language, and they're called Broca's area and Wernicke's area. And both of these are located in the left side of the brain in the vast majority of people. So you might often hear that language is on the left side of the brain. So Broca's area is actually in the back part of the, let's see if this works, the back part of the frontal lobe, and it's responsible for the production of language, the expression of language. Okay, and the other important area is called Wernicke's area, which is right here, and it's kind of in the back part of the temporal lobe, and it's involved in the understanding or the comprehension of language. Okay, now having shown you the specific areas of the brain involved in language, I don't want to leave you with the impression that that's all there is to language, okay, because it's much more complex than that. In fact, how we communicate language, and in this example, spoken language, is more than just words that arise from the brain. So, for example, it also involves hearing, and I know that Barb's going to be speaking about hearing a bit later in the night. And it also involves higher level cognitive skills, that are vital because those are the skills that allow us to generate our thoughts in the first place that we may or may not decide to put into words. Okay, and also nonverbal communication is really important with language and communication because things like your facial expression, your gestures, your posture, all of that is going to contribute to your ability to communicate as well. So it's really a very widespread and complex system, and we're really kind of focusing just on a very narrow part of it today. Okay, so as I've kind of alluded to before, there are two basic categories of language. There's expressive language, which is kind of the output. So this is producing language and expressing it in either a spoken or a written form. And receptive language, which is the input into the system, and it's taking in language and processing it and understanding it. So I'm going to throw just one more definition at you. I promise this is it. It's called aphasia. And what aphasia is it's an impairment of language affecting the production or the comprehension of speech and the ability to read or write. So basically, aphasia is what happens when something is going on in the brain to cause different parts of the language areas to not work properly. And I'm bringing up this term because the disorders of language that I'm going to be talking about are really different kinds of aphasias. Okay, so now we're going to get into some of the specific problems that you can see when the language parts of the brain aren't functioning as they should. And first I'm going to describe some of the expressive language problems. So the first one is word finding difficulties. So they're the most common type of problem that you're going to see. And you see them not only in dementia, but also in normal aging, unfortunately. So we all have this problem, right, from time to time, right? So especially as we get older. So this is when you can't think of the word that you're looking for, right? Or the name of the person, or the name of the movie, or the name of the actor, et cetera, et cetera. Some people also call it the tip of the tongue phenomenon. So it feels like that word is right there, and you might even know the first letter of the word, or you might know how many syllables it is. But for the life of you, you cannot come up with that word. So it's a very common problem, even in normal aging, but it also occurs in dementia. The next one is something called anomia. So what anomia is I don't know if any of you have ever had a cognitive screening test at your doctor's office. One of the things that's very common is for your doctor to ask you to name a few pictures on a test, or maybe to name some objects in the office. And there are some people who have trouble coming up with the words when shown a picture of something. And what's happening is they just can't find the word that goes with that visual image. Okay, and we call that anomia. The other thing on the screen here is something called paraphasic errors. Okay, so these are word errors, and there are two main types of those. The first one is called the phonemic paraphasic error. And this is a word error in which the produced word is kind of like a nonsense word that sounds similar to the word that we meant to say. So as an example, somebody might say harmonica instead of saying harmonica. So it kind of sounds similar, but it's a nonsense word. In terms of the semantic paraphasic errors, those are a little bit different. So that's when a word that's meant to be said is substituted with an incorrect real word that has some kind of an association to the original word that they're thinking of saying. So as an example, somebody might say a plane instead of a helicopter. They're kind of on the right track, but it's not the exact specific word. Another example is guacamole instead of avocado, and guess who actually made that error? Yours truly. So I actually said that a couple of weeks ago when I was cooking. So instead of, I went right from the fruit to the full recipe with that error. So my point is that, again, it's not necessarily abnormal to make these kinds of errors once in a while. And particularly as we get older, people will make these kinds of errors if they're really tired, if they're in pain, if there's anxiety and depression going on, or sometimes medications can even cause us to have cognitive issues. So it's not necessarily abnormal depending on the circumstances. Okay, just moving on with other types of expressive language problems. Another thing is sometimes people show very slow and effortful speech. So it can seem like a real struggle for them to get out the words. An example of this is something called a telegraphic speech. So this is where mostly content words, such as nouns and verbs, are used without all the filler words that go along in a sentence. So an example that I have up there is if you're asking somebody, what are you doing for Christmas? Or, what are you going to do for Christmas? Somebody with telegraphic speech might say something like, eat tasty things, presents, Christmas, draw numbers, all get presents, $10, $10. So they're really kind of missing a lot of the filler words, but on the other hand, it makes sense. They're getting their idea across. In contrast, there's something that's a little different called word salad. And this is when speech sounds fluent, it sounds natural, and it's provided easily without effort. But there's a whole bunch of paraphasic errors that are kind of stuck into the speech as the person's talking. And because of that, the meaning becomes incomprehensible. So the example up here, if you ask somebody, how are you doing these days? Somebody with word salad might say, I've got the idea that I've been taken better. You can hear that with the walking, of course, on one side, but I think it's nice, my idea too. But if it does not work, then it does not work. I think quite teasy about that. We never say it's not possible or it does not work. And that's what I did. That's the way I am, right? So it's very fluent, it's very kind of flows naturally, but it really doesn't make a lot of sense. So these are just examples of actual examples from patients that have had these types of word problems. And finally, problems with written expression can also occur in terms of the output, and the technical term for that is agraphia. Okay, so on the other side of the coin, there can also be problems with taking information in. So the main difficulty here is with problems understanding language. So the person with dementia will hear what you're saying, but the speech coming at them may sound almost like a foreign language to them. They're just not going to understand it. And early on in the receptive disorders, there's going to be a loss of meaning of certain words. So it's just going to start with certain words. And it usually starts out with less frequently used words. So, for example, if you said a word like a hammock, if there's a hammock in your backyard or something, and the person with dementia might seem really confused by that word and just have no meaning attached to that word whatsoever. Just like if someone said a word in a foreign language to us that we had no idea what it meant, it would be similar to that. And then in terms of the reading, problems with reading, which is also a receptive language problem, we would call that alexia. That's the technical term for it. Okay, so now that I've given you some background in the types of language problems that can occur in dementia, I'm just going to go through a couple of types of dementia just to give you some ideas of what would occur in terms of language problems. And I'm going to start with Alzheimer's disease, which is the most common form of dementia. So in the early stages of Alzheimer's disease, language is actually usually preserved at the beginning, okay? So it's not something that's the first thing that you typically see. You probably know that memory would be one of the first signs. But as, even in the early stages, as the disease goes on, what you're going to notice, first of all, is some word-finding problems are going to become much more frequent, as well as the naming problems that we talked about earlier. And what happens when people have word-finding problems is they do something called a circumlocution, another technical word, where they can't find the word, so they kind of work around it. So if they're thinking of a unicorn, for example, they just can't find that word, so they might say, well, it's a horse with a horn, right? So they're able to get their idea across, but they just can't come up with the word. And in the early stages of dementia, in terms of paraphasic errors, what you're going to see is a lot of semantic paraphasic errors, as opposed to the phonemic errors in the initial stages. And then as the disease progresses, it's going to start to affect comprehension as well. So in the middle stages, it's going to become more apparent that they're having problems understanding people as well. The problems with reading and writing are going to start to occur. At this stage, you're going to also get phonemic paraphasic errors in addition to those semantic errors we talked about. And then the expression of the patient is going to become much more vague and less detailed. And then finally, in the later stages, all aspects of language are going to be affected. I also want to talk about one other type of dementia, and this one is very different. It's called frontotemporal dementia, and it's actually a group of brain disorders that share some similar pathology in the brain, but there's several different subtypes. And there's two subtypes in particular that tend to affect language very early on in the course of the dementia. And the first one is called non-fluent primary progressive aphasia. That's a bit of a mouthful. And what you see is very early on, one of the very first symptoms are going to be problems with expressive language. So you're going to have very effortful speech, very hesitant speech. Stuttering may occur as well. And as the disease progresses, the expression's going to get worse and worse until eventually the person stops talking. But in the initial stages of that particular condition, comprehension is actually pretty intact. So they're going to understand what you're saying to them. They just can't get the words out. And then on the other side of it, the semantic primary progressive aphasia, it affects comprehension instead of expression in the early stages. So you're going to get a progressive decline in word comprehension, naming problems. Again, you're going to get this kind of word salad type of speech where the speech is fluent, but it's empty. There's really nothing there. And in this type of condition, they also, interestingly enough, have problems sometimes even recognizing objects. So it's not that they can't find the name for it, they actually don't know what the object is. So they just, they've lost their connection to even knowing what that object is, as well as familiar faces of people too. Okay, so I've talked a lot about the kinds of language problems that you might see in the various dementias, but I do want to come back to what I said at the beginning of my talk, that the impact of losing the ability to communicate is very significant. A decline in communication can have all kinds of adverse effects for the person with dementia, so things like fear and frustration and confusion, etc., and not surprisingly, an increased risk of depression. And in addition, there's potential safety issues for that person too, because you're unable to communicate with them. And finally, it's also important to note the impact on the family. So losing the ability to communicate with your loved one can result in a significantly reduced connection with that person, and therefore it's a huge sense of loss. So I know that Carrie is going to be speaking next about how to improve these problems with strategies to assist people with dementia and their families. So I'm going to end on this quote from an ancient Greek philosopher, and I think we can all benefit from this advice. So thank you very much for your attention.